It was initially dismissed as a sign of aging, slight fatigue, a touch of dizziness after climbing stairs, a fleeting heaviness in the chest. But fate had a trial in store, the day when an ordinary breakfast nearly became the last. At 67, the protagonist of this story found himself in the hospital with a suspected heart attack. A non-drinker, non-smoker, who considered himself quite healthy, he heard a terrible verdict from the cardiologist. You are killing your heart with what you eat every morning. This moment became a turning point. That's when he learned about Dr. Bokeria, a man whose life and work are an example to follow. At 90, he maintains mental clarity and energy, daily consuming one simple product that cleanses blood vessels, supports heart health, and prolongs life. But this is just the tip of the iceberg. It turns out there are two products that daily harm blood vessels, even if you don't suspect it. Giving them up could give you extra years of life. And the ritual that Dr. Michael DeBakey, a colleague of Dr. Bokeria, shared can literally reboot your heart. If you strive for health, a clear mind, and a life without medication, 7 simple but ingenious secrets of longevity await you. Some of them may surprise you, but the most destructive, as always, lies ahead. So let's start with the first secret, without which no morning of Dr. Bokeria is complete. Number 1. 2 days in 1. Why does Dr. Bokeria always wake up before 6:01 a.m.? Bokeria often repeats, "He who rises early lives 2 days in 1. For many, this is just a beautiful phrase, but for him it's a life philosophy. He started waking up before 6 a.m. in his youth, and this ritual has become his unwavering habit. Not following fashion, but listening to his feelings. The morning hours give the body and brain something special. This is the time when the body and heart work in a calm but deep mode, when blood flows more smoothly, thoughts are clearer, and energy surpasses any coffee. He doesn't just wake up early. He does it with a purpose. Every day he jokingly says that thanks to this, he has lived not 90, but 170 years. There is a grain of truth in this joke, confirmed by research. Early rising reduces morning stress levels, improves heart function, and restores biorhythms. Late bedtimes after midnight have a devastating effect not only on the daily routine, but also on the state of blood vessels, and this negative impact often goes unnoticed. As a person starts their day, so they live it. Academician Bokeria emphasizes the importance of falling asleep before 11 p.m. and waking up before 6:09 a.m., claiming that after a week of following such a regimen, you can feel how the body begins to function in a new way. However, if you continue to ignore the morning hours and sleep until 9 a.m., you deprive yourself of valuable time and opportunities for health that can no longer be returned. But this is only one side of the coin, as there is another, seemingly harmless habit that can provoke serious cardiovascular problems, up to a heart attack. We are talking about a dangerous morning habit that many underestimate. Every day, millions of people make the same mistake. Immediately after waking up, they go to the kitchen and first of all, prepare a cup of strong coffee. This morning ritual has become so familiar that it is difficult to imagine the beginning of the day without it. However, according to Dr. Bokeria, this habit can pose a serious threat to health. Drinking coffee on an empty stomach, especially after incomplete sleep, has a strong impact on the body. Caffeine stimulates the nervous system, which leads to a sharp increase in blood pressure and heart rate. In an empty stomach, this effect is enhanced. The mucous membrane is irritated, an excessive amount of acid is released, and the heart receives an alarm signal. This is how a chain of events is triggered, which can ultimately lead to a heart attack or stroke. An example is the story of a 74-year-old woman who for many years started her morning with a cup of black coffee, without eating any food. "It's just a habit," she said, until one day she lost consciousness and ended up in the hospital. Doctors diagnosed her with vasospasm caused by a sharp jump in pressure. She was lucky, but unfortunately not everyone gets a second chance. Dr. Bokeria strongly recommends starting the morning with a glass of warm water, which helps to wake up the body and prepare the stomach for food. After that, a light breakfast should follow, and only after half an hour, if necessary, can you drink coffee. Everything should happen sequentially, without haste, since morning haste can be costly in old age. Unfortunately, many people consider coffee a complete breakfast, which is highly undesirable. What else Dr. Bokeria does not recommend doing will be revealed later. Third, there is a forgotten but vital exercise that can prevent blood clots. In youth, few people think about the importance of mobility. But with age, every morning spent immobile becomes a step towards blood stagnation, clot formation, and loss of joint flexibility. Academician Leo Bokeria emphasizes that morning exercises are not just a sports workout, but a vital necessity for maintaining life. The cardiac surgeon never started his day without performing a few simple exercises: head rotations, arm movements, torso bends, and leg raises. These simple actions, aimed at dispersing blood and awakening the body, take no more than 5 minutes but have a healing effect. Warmed-up muscles stimulate blood circulation, activate brain function, relieve tension from the spine and joints accumulated overnight, and, most importantly, prevent blood clots. A story from Virginia tells of a 76-year-old former accountant who, after retiring, stopped moving and spent his days sitting in front of the television. A year later, he needed his first vascular surgery, followed by a second. The man thought he was resting, but in reality his body began to fade due to inactivity. Now, every morning, he says, "It's like coming back to life. I feel alive again." Dr. Bokeria advises starting small, doing exercises even while sitting if necessary. The main thing is to move. This is not a workout, but a signal to the heart. I'm alive, I'm active, I'm okay. Fourth, there is a morning ritual, smiling in the mirror, that can prolong life. It may seem that an ordinary smile is not of great importance, especially in the morning when a person has just woken up, their body has not yet awakened, and their mood leaves much to be desired. However, it is at such moments, according to academician Bokeria, that it is necessary to perform a simple action. Smile at your reflection in the mirror, even if it seems difficult and unnatural. Why is this so important? The thing is that when a person smiles, the brain receives a positive signal. Everything is fine. As a result, the production of dopamine and endorphins begins, hormones of joy and relaxation, which leads to a decrease in stress levels. And stress, according to Bokeria and his colleague Michael DeBakey, is the main enemy of the heart. It has a destructive effect on blood vessels, accelerates the aging process, and can lead to heart attacks even in those who adhere to proper nutrition. In a quiet corner of Pennsylvania, a lonely elderly woman shared her secret to cheerfulness and good mood. Every morning she started with a simple but powerful ritual, saying a phrase that sets her up for positivity. You can do it. You will succeed. At first it seemed like a naive idea, but after only a couple of weeks, she noticed amazing changes. Her mood improved, energy appeared, irritability receded, and most importantly, her blood pressure normalized. This case clearly demonstrates how often people underestimate the impact of emotional mood on physical condition. The body and mind are inextricably linked, and positive thoughts can work wonders. A smile is not just a simple contraction of facial muscles. It is a powerful signal to the body about the need to live long and happily. The more often a person gives himself and others a smile, the stronger his cardiovascular system becomes. However, it is important to remember that all these methods only work when the body receives the substances necessary for normal functioning. And here, as Dr. Bokeria notes, many people make a gross mistake, neglecting a proper breakfast. Dr. Bokeria figuratively calls breakfast the foundation on which the whole day is built. All actions and processes taking place in the body during the day depend on how high quality the morning meal was. What happens if the foundation is missing or does not meet the requirements? The body begins to malfunction, and a person often does not understand the true causes of his poor health. Many people start their day with sandwiches, dry cereals from a box, or skip breakfast altogether, and then complain of fatigue, blood sugar spikes, high blood pressure, and anxiety. But these are not random coincidences. It is the first meal that starts metabolism, activates brain function, affects hormonal levels, and, of course, affects the heart. Dr. Yes. Bokeria himself has been starting his morning for many years with simple but carefully thought-out food. Oatmeal with a small amount of butter, a boiled egg, and fresh fruit. These products are easily digested, provide a feeling of fullness, and do not overload the body. Such a breakfast does not create problems for blood vessels, but on the contrary, helps them function. As an example, we can cite the story of a 69-year-old former schoolteacher from Ohio. She suffered from chronic blood pressure spikes and headaches. The doctor advised her to change her morning diet. She gave up her usual coffee on an empty stomach and included porridge, eggs, and fruits in her breakfast. After 3 months, her blood pressure stabilized and her headache stopped. At the same time, she did not take any new medications, but simply changed her breakfast. Dr. Bokeria calls breakfast a kind of system reboot. By giving it up, a person deprives himself of stability, and his body is forced to catch up during the day, which can lead to overeating, sudden changes in blood sugar levels, and fatigue. However, even the most useful breakfast cannot compensate for the harm caused by products that poison the heart. You can find out what products Dr. DeBakey gave up later. The sixth point warns of a hidden threat that the outstanding cardiac surgeon Michael DeBakey was especially cautious about after the age of 50. This man, whose knowledge of the heart was invaluable, avoided eating fatty meat and oil. He argued that fried food causes irreparable harm to blood vessels, covering them with an invisible film that eventually narrows the lumen of the arteries and makes them fragile, which can lead to fatal consequences such as thrombosis, stroke, or heart attack. As an example, we can cite the story of a 72-year-old veteran from Texas who, having become accustomed to meat food during his service, ate fried meat every day. As a result, he ended up in intensive care with heart failure. After a successful operation and stent placement, he completely abandoned oil and fatty meat, regretting that he had not done so before. DeBakey recommended steaming, baking, and eating more vegetables, explaining that the less processed the food, the easier it is for the heart to digest. He was not against meat as such, but against excessive consumption of fats, especially after 50 years, when metabolism slows down and blood vessels become more vulnerable. His words warned, "Every fried cutlet brings a person closer to the operating table, and it is better to avoid such steps." However, in addition to proper nutrition, there is another important ritual that can revive the heart even in those who do not make changes to their diet. And this was said by both DeBakey and another famous cardiac surgeon, Bokeria. We are talking about a magical walk, just 30 minutes of which can transform the state of the cardiovascular system. DeBakey started his day with a walk, regardless of the time of day and weather conditions, realizing that movement is oxygen for the heart. At the same time, he emphasized that we are not talking about gyms, marathons, or grueling workouts, but about measured walking. He said that if a walk could be put in a pill, it would become the most valuable medicine in the world. Studies confirm that just 30 minutes of walking a day reduces the risk of heart attack by half, and alternating calm and fast steps helps to improve blood circulation, increase the elasticity of blood vessels, and strengthen the heart muscle. In Illinois, a 78-year-old woman shared her story of how she had suffered from insomnia, high blood pressure, and anxiety for a long time. After a doctor recommended that she start daily walks, she began to go outside twice a day, in the morning and in the evening. After a month, her sleep became stronger, her blood pressure returned to normal, and, most importantly, she regained control over her body. Outstanding cardiac surgeons, such as Bokeria and DeBakey, were unanimous in their opinion: movement is life. Without it, even the most balanced diet will not be beneficial, while physical activity can transform the state of the entire body. What if there was a product that not only supported health, but also acted as a kind of brush for blood vessels. Another legendary cardiac surgeon who lived a long life to 98 years knew about this. We are talking about Dr. Cucci, a legendary man in the world of cardiac surgery, who lived to a ripe old age, maintaining clarity of mind, physical strength, and even the ability to drive a car. He was convinced that the secret of his longevity lies in plant-based nutrition, but not just in eating vegetables for the sake of diet, but in one specific product that he included in his diet every day: cereal flakes. It was with a plate of such flakes, poured with soy milk, with the addition of fresh fruits, a small amount of nuts and orange juice, that his every morning began. Simple, but effective. The fiber contained in whole grains acts as an internal broom, helping to remove cholesterol, cleanse the body of toxins, and free the walls of blood vessels from deposits that in the future can cause heart attacks. Cucci said that he had seen hundreds of patients with amputated fingers and feet due to blocked blood vessels, and did not want to be among them. Therefore, starting at the age of 50, he began to change his eating habits, eliminating red meat, fats, and sugar from his diet, and preferring legumes, vegetables, and nuts. He even divided his dinner into 2 parts. He ate one in the evening and left the other for the morning to avoid overeating and not overload his heart. Once he said, "I don't know anything about health problems. I just keep living." His story is not a miracle, but a result of discipline, a conscious approach to life, and the power of habits. An important conclusion that unites the views of Bokeria, DeBakey, and Cooley is that the health of our heart directly depends on our lifestyle, and it all starts with small decisions, with the formation of healthy habits, and with the first step towards a healthy lifestyle. Over the years, there is an understanding that true health is not just a set of medications, but a harmonious way of life. It is a combination of daily decisions and actions, carried out not occasionally, but systematically, here and now. Examples of outstanding personalities, such as Bokeria, DeBakey, and Cooley, whose lives were long and fruitful, clearly demonstrate that their achievements were made possible not by miraculous pills, but by the timely abandonment of bad habits and a conscious choice of a healthy lifestyle. Do not wait for alarming bells in the form of diagnoses or pronounced symptoms. The appearance of these signs indicates that the body has long been sending distress signals that have been ignored. It is important to listen to yourself and not neglect the needs of your body. Perhaps it has long been time to reconsider your eating habits, but there was no starting point. Or perhaps a sports mat is gathering dust in the corner, reminding you of forgotten promises. Sometimes, looking in the mirror, it seems that time has been lost. However, this is not the case. While there is life, there is an opportunity to change everything for the better. You can start small. Wake up a little earlier, drink a glass of clean water, give yourself a smile, do a few simple exercises, follow Dr. Cooley's example in nutrition, and take a 20-minute walk in the fresh air. These steps do not require excessive effort, but represent a path back to yourself, to your health and well-being.